Millions of Americans are fighting the battle of the bulge, and many of us are losing. According to the Center for Disease Control, 65% of adults are either overweight or obese, and over the past 30 years, the number of overweight children has tripled. It's a frightening trend.
The long-term health effects of obesity primarily are a shortened lifespan, and this happens because people that are severely obese get type 2 diabetes, they get high blood pressure, they're very susceptible to certain types of cancer, they have breathing difficulties. The list just goes on and on.
Many are determined to lose weight, but as statistics show, it's an uphill battle. While some turn to diet pills and shakes, healthcare professionals caution there's no magic solution for weight loss. At 5'3" and 246 pounds, Bridget Bowie was morbidly obese. Bridget tried every quick fix she could find to slim down.
I did feel like I was at the end of my rope. I was very frustrated. I had previously lost weight and gained it back, plus more, several times. And I knew I had to do something because I just kept gaining more and more weight, and it was more and more limiting to my desired lifestyle.
When all else failed, Bridget decided that weight loss surgery was her best option. She had two options: gastric bypass surgery and the newer adjustable gastric band procedure. Gastric bypass is the time-tested gold standard in weight loss surgery. It offers rapid, dramatic weight loss in about a year. Adjustable gastric band surgery is a less invasive alternative to gastric bypass. It involves no cutting of the stomach or rerouting of the intestines, and a quicker recovery, but slower weight loss. Bridget chose adjustable gastric band surgery.
When we put an adjustable gastric band into somebody, we do this laparoscopically through several small incisions and place an inflatable band around the upper stomach. And we connect it to a port that lives under the skin, and we do our adjustments by inflating the balloon via that port that we access in the office with a little needle. When the band is properly adjusted, the stomach pouch is very small, patients get full quickly, and they stay full for a longer period of time so that they're really only hungry before their next meal, which ends up being a small meal because of the small pouch.
A person's a candidate for an adjustable gastric band. First, they should be about 100 pounds overweight or have a BMI of 35 with health problems associated with their obesity, or if their BMI is 40, with no health problems, they're considered a candidate. They need to have tried other diets and other methods of losing weight without being successful, and those are the people that we're looking to help.
Today, 2.5 years after her surgery, Bridget has lost about 100 pounds. Not only does she have renewed self-confidence, but she now looks forward to a longer, healthier life.
I'm much more active and self-confident. I feel good about who I am and where I am in my life now. I would recommend the adjustable gastric band to other people who are interested in losing weight and maintaining that weight loss, because it is a way to achieve your goals and to live longer, be healthier, and feel better about yourself.
Georgia Coast Surgical has helped more than 1,200 people lose weight and live longer.
Our mission, as I see it, is to make a positive difference in the lives of our patients, and we try to do this by combining our surgical expertise with compassion, a total commitment to their total well-being, and we try to offer them the respect that we feel that they deserve. We also do a lot of other types of surgery. We've been doing surgery for quite a number of years, so we consider ourselves experts in the field of gallbladder surgery. We do minimally invasive abdominal surgery of all types, including bowel and colon surgery.
The Georgia Coast Surgical team is led by Doctors Peter Henderson and Harold Kent. These two surgeons each offer expertise in gastric bypass and adjustable gastric band surgery. Weight loss surgery reduces the size of the stomach, limiting the amount of food a patient can consume. The result is dramatic weight loss.
I had gastric bypass surgery October the 16th of '06 with Dr. Henderson. My weight was 271, my BMI was 48. That's been 15 months ago today, and I'm down to 156. and my BMI is 26. My life has totally changed. I'm living, I'm walking 4.5 miles a day, every day, and I'm living life. It's wonderful.
When we have massively obese patients come to our office, one of the first things that we try and tell them is that they don't have to stay this way for the rest of their lives. You know, we can give them help. And we can give them help surgically, and we can support that with our nutritionist and with other means that we have at our disposal.
The professionals at Georgia Coast Surgical know that weight loss surgery isn't a quick fix. That's why they offer post-surgical counseling, group meetings, and other support services.
We think we have a very unique program here. First of all, we've done over 1,200 cases since the time we started this about 6 years ago. And we offer a very in-depth preoperative educational program, which is something that's not always found in these programs. We have a nutritionist, we have 2 clinical psychologists that work closely with us, we have support groups in multiple communities, and we have a unique healthy eating workshop that occurs about once a month that all our patients are required to go to, so they'll know how to deal with this huge life-changing experience.
Actually, post-operative care and follow-up is the most important thing about weight loss surgery. The regular follow-up, support groups, psychological support, as well as dietary counseling, and just touching base with your doctor on a frequent basis is extremely important and makes the difference between whether or not patients do well or whether they don't.
Combining experienced surgeons and a compassionate staff, Georgia Coast Surgical will continue to help patients make this life-changing journey.
My cardiologist recommended Dr. Henderson and Dr. Kent. I came down here, met the staff, saw the program. Everything's under one roof. They take care of you from the beginning to the end and after, because this surgery is just a tool. To be really successful, you have to have the complete package from the very beginning to the end, and they are a circle of excellence center, which is very hard to get.
I would recommend Georgia Coast Surgical to anyone who was interested in any type of weight loss surgery. The staff is very understanding. The physicians are very attentive to your needs and your concerns. Everyone involved you feel like they're catering to you and you're their only patient.
Now, the future of Georgia Coast Surgical, as we see it here, is to try and extend our means of helping morbidly obese patients to more and more patients over a wider and wider area in order to achieve better health for the maximum number of patients that we can care for.